Hi, my name is David Wild. I'm the Chief Scientific Officer for D2D Discovery. Now I'm going to be giving the 5-minute introduction to what we do and why we're doing it. So we kind of have a big problem, but an even bigger opportunity in drug discovery data. Um, Pharmaceutical companies have built up high-value collections of data, usually in tables in relational database form, with various mappings between the tables that allow some level of utility of that data, for instance, in predictive modeling and being able to find associations between different kinds of data. But then we have this huge kind of a rich store of public and commercial data that's available, that's particularly in the last 10 years has developed. But there's no simple way to really map what's going on in the proprietary data to what's going on in the public data. And even more importantly, to be able to find associations between entities in both public and private data, and being able to make predictions about, for instance, the action of drugs or targets based on that data. And so why haven't we solved this problem now? Well, there are all kinds of reasons why. The relational model requires a very rigid structure. It ties closely the structure of the data with the data itself. So it's very difficult to properly map in external sets, and that has to be done on a kind of one-by-one basis. And then in the public and commercial data world, we've got, often have data and tools tied together. It's complex to map the data. The data vendors don't necessarily work well together. But probably most of all, until very recently, there's been no practicable technologies for doing flexible integration of drug discovery data. That's now changed. And in the last few years, we've been able to practically employ semantic technologies to properly map together all the data that we want to map together, relating to drugs and genes and diseases and targets and compounds and pathways and disease states and side effects and so on. And we actually were the first in data discovery scientists to show that was possible to do for public drug discovery data. And we now have strong initiatives like OpenFact, which are enabling this data to become available in integrated form. But really, the people working in this area are mostly concerned with integrating the data and then making it searchable. But what about finding important connections in the data, finding hidden associations in the data, being able to build predictive models and run predictions that go over different silos of data and different kinds of data? Well, this is where data discovery comes in. So data discovery made the first comprehensive integrated semantic data set for drug discovery. It's called Chem2Bio to RDF. Our scientists made this, and this the publication now has 87 citations, I think. And we showed the utility of what you could do even just with searching. For instance, we can answer questions like what pathways will troglitazone affect, and do searches that go across many silos of data. But even more importantly, we're able to develop technologies that enable you to make predictions across data sources. So for instance, our SLAP technology, semantic link association prediction, can find hidden associations between drugs and targets based on complex statistically valid networks that underlie the data about those compounds and targets. And even better, we can interpret those. So what you see here is actually a subnetwork of highly significant relationships between a particular drug and a target, and we can explore those relationships directly. But we can also use them numerically to make predictions. One application we're working with the Indiana CTSI is actually to create a map of the hidden molecular connections of diabetes. We can use SLAP technologies to profile compounds and targets with endpoints like disease states and pathways related to diabetes, and actually find connections that haven't been found before. We've already been able to do this, for instance, looking at thiazolidine drugs, and found new connections with those drugs. Working with a large pharmaceutical company looking at SLAP technologies for drug toxicity, exploring adverse events and being able to make predictions of adverse events that use all the integrated data and that are able to go across data silos, be they proprietary and public, or domain silos. So we're integrating toxicity data with other data, and then being able to do adverse event prediction, mechanism of action discovery, and endpoint association, and build various maps from that that can help us not just make predictions of adverse events, but understand them. So one point about SLAP is that it can be flexibly applied to new data domains and sources. We can integrate in proprietary and public data, as we said, but we can add in new domain data for different applications. We've already looked at diabetes. We're looking at drug toxicity. We can do this for DMPK data, competitive intelligence, patient data, metagenomics and animal data, GWAS data, and so on. So that was a 5-minute introduction. If you want to know more about data discovery, please go to our website, d2discovery.com. You can email me directly, david@d2discovery.com. And thank you for listening.